The drastic downsizing of the U.S. overseas aid program is affecting humanitarian work in dozens of other countries. South Africa has been especially hard hit, being home to the world's highest number of people living with HIV and AIDS. Vaccine trials have come to a halt, and the foundation of the late human rights activist Archbishop Desmond Tutu says 500,000 lives could be at risk.
Nozuko Majola lives in a village in South Africa's east, worlds away from the White House. But President Trump's decision to slash foreign aid has hit close to home. HIV is prevalent here, and many living with the virus, like Nozuko, have relied on U.S. funding for their medication. But it will no longer be delivered to her remote village. Nozuko doesn't know if she can afford the one-hour trip to pick it up.
Transport is a big issue in this area, and we don't get regular visits from the mobile clinic. If you're going to rely on a mobile clinic, you often miss it because the schedule is unreliable.
Clinics funded by the U.S. are also closing as part of Trump's push to cut federal spending. People fear that there will be a surge in HIV deaths and infections.
We're being killed in this manner. We're going to die. You know, the day I heard that funding had stopped, I felt like I was dying.
Even in big cities like Johannesburg, people rely on specialist clinics that are funded by the U.S. They provide a lifeline and reduce the stigma around the virus. This activist, who takes preventative HIV medication, says people will skip their treatment if they're forced to go to state clinics. And she has this message for the U.S. president.
So my plea is that you re-evaluate the humanity in your executive orders. Look at what each of those executive orders are dehumanizing.
Labs that were fully funded by the U.S. have been ordered to close, and plans to trial an HIV vaccine on humans have been put on ice. 15,000 jobs are at risk. With the highest HIV rates in the world, South Africa has become a hub for vaccine research. Its success could hinge on filling the funding gap left by the U.S.
Diane Hawker helped file that report and joins us now from Johannesburg. Good to see you, Diane. Can you give us an idea of how Trump's defunding of U.S. aid will affect South Africa's HIV/AIDS work?
Well, the South African government has, I think, quite an extensive program that does go to many parts of the country. But the challenge is that there are some districts in the country where the government funding just simply is not enough. And this is where the USAID and PEPFAR funding has come in to help with operational budgets as well as staffing budgets. These are the budgets that are now going to be put under pressure as a result of this decision. The Department of Health has previously said that about 17% of the overall national budget was supplemented by this funding. That's about $460 million, which is a significant amount of money that the government will have to find in quite a short space of time to ensure that people continue to access this kind of care, not just medication, but also testing that is supported by these funds, as well as other preventative projects.
Does South Africa have a plan for compensating the shortfall that USAID's withdrawal is leaving?
Well, so far the government hasn't revealed a plan, but that may be because the budget that was meant to be released in February has not yet been publicized. The government has said that it will have to try and move money around from other projects, but we haven't yet heard which projects those will be and whether it will be able to fill the full gap. I think one of the big problems as well, Nicole, is that even though this funding supplemented government clinics, there were also private clinics that were also getting funding, like one that was attended by one of the people in that story. And the private clinics, for example, would have to try and look for other private funders who would then be able to fund the projects that they are running. So the impact, I think, will still be quite much larger than that 17% of the budget that the government is looking to replace.
We heard in the report that South Africa has become a hub for vaccine research. Tell us more about that.
Yes, absolutely. South Africa has a number of preeminent scientists who have been working on HIV research for over 2 decades. We have a lot of large universities like Wits University and the University of Cape Town, which have research hubs within them. And one of those research hubs is one called Brilliant, which is a research hub that actually involves scientists from across the African continent. This is one of the hubs that will be really impacted by this because it was largely funded by the USA funding as well as PEPFAR. And they will have to now put those trials on hold to see if they're able to find other funders. They were at a stage with one of their trials where they were already looking at whether they could start giving that medication to a small group of human participants. And then, of course, there would have been research done as to how they react. So very critical, projects that are now being put on hold as a result of this funding issue.
The new U.S. policies being felt around the globe. That was DW's Diane Hawker in Johannesburg. Thanks so much for that.
Thank you.